Okay, so if I press escape, maybe I can get to mine. Is that how we do this? Okay. Thank you very much for that introduction. Well, my name is Speck, and I am a cardiologist at Swedish Medical Center. And I spend about half of my time in an exam room talking to patients who come to me with their particular issues about their health concerns, and about half of my time leading a team of health professionals, including nurses, psychologists, health coaches, as well as exercise physiologists, in trying to tell people how this could be the better day and the first day of the rest of their life, and teaching them how to live in a more integrated fashion so that they can, in fact, dissipate some of the symptoms that are clearly stress-related. And so I just want to go through, this is going to be a little bit of a physiology talk for you, because I see my task as kind of saying, we all know that stress is bad, but why is that? And I want to start out with something that's pretty clear in terms of a stress-related life. This is Franklin Delano Roosevelt in 1932 when he was visiting Washington and campaigning. And as many of you know, Mr. Roosevelt had polio. He also smoked. He also drank heavily. And he had a fairly stressful life. These are his blood pressure readings as he progressed through his term. And as you can see, he started out fairly normal at 136/78. By the time we decided to enter the war, he was 188/108. For those of you who don't know, a normal blood pressure is less than 140 on the top and less than 90 on the bottom when you've been seated quietly for 15 minutes. As the war went on, you can see that he got to a fairly high blood pressure, 210/112. And as he was planning the fate of the free world with Churchill and Stalin, his blood pressure was 300/160. Now, in all fairness, the only medication we had available was something that was an injectable drug, and the advice was bed rest, don't smoke, don't drink alcohol, avoid stress, none of which he did. 3 months later, he was dead from a cerebral hemorrhage. Cardiovascular disease is the leading cause of death in this country for men and for women. In fact, more women die of cardiovascular disease, as seen here in yellow, than men do. And just as an editorial, I would tell you that's because women are much more capable of taking care of the people that they love than of themselves. And if we talk about vacations, it's usually the wife who's planning it. It's usually the wife, particularly lower socioeconomic groups, it's the wife who's planning the meals, who's cooking the meals, and where was my vacation? Cardiovascular disease far exceeds cancer deaths, including those from breast cancer in women and smoking, as well as accidents, diabetes, and dementia. But unfortunately, it's not confined to the United States. And as you can see, even though there are good policies in Europe, as we import not only our diet, not only our sedentary lifestyle, but also our work ethic to places like Northern Europe and to China in particular, you can see that the incidence of cardiovascular disease is increasing. In fact, it's only dwarfed in the African American subcontinent because of the prevalence of AIDS. Now, this is a diagram that I have in every exam room, and when patients come to me about concerns of their heart, we go through this. And so I'm going to go through it with you as if you were sitting across from the exam table with me. This is a cross-section of your artery. The arteries are the blood vessels that supply oxygen to your tissues. Could be the arteries that supply your head, those are called the carotid arteries. Could be the arteries that supply your heart, those are called the coronary arteries. Could be the arteries that supply your extremities. Those are called the peripheral arteries. The artery is lined by a thin layer of tissue that's called the endothelium, and for all intents and purposes, you can think of that like the skin. Like the skin, it has layers, and the top layer can slough, and a nice new layer can come up from underneath, or like the skin, it can become inflamed. And the inflammation can be transient, like a sunburn. You get out of the sun, everything heals over, everything's fine. Or it can be something like more chronic, like eczema or psoriasis, where it flares, and then it heals, and then it flares, and then it heals. And during the flare phase, the lining of the blood vessel becomes very similar to that of the skin. It's roughened, it's cracked, it's reddened, it's weepy, and during that time, these little LDL particles, which are the lousy cholesterol, the bad cholesterol, literally penetrate the lining of the blood vessel and start to collect in this little fatty tissue layer underneath. They become joined or engulfed by the white blood cells. They turn into something called foam cells, and the foam cells start secreting chemicals called cytokines, which perpetuate the inflammation. So the story about cholesterol plaque development is really about inflammation. It's not just about cholesterol, it's not just about high blood pressure, it's not just about diabetes, it's not just about your parents, it's about what causes inflammation. And stress chemicals are right up there in what causes inflammation, and we'll learn a little bit more about that as we go on. What I want to call your attention also to is this process can start from the first decade of life. Somebody told me once that primary prevention is never taking your kid to McDonald's, and that's probably true because a high fatty meal acts like a Brillo pad to the inside of your blood vessels. Now, why do you take your kid to McDonald's when you have and you feed them high fatty meals? Because you don't have time to cook, because you are working, you're taking care of your mother, your teenage kids, you're schlepping them around, and oh, by the way, I've got to get the church activities done before next weekend. And we are just starved for time, and we make choices that affect our children from the first decade of life. By the time we get to the fourth decade of life, you can see that the cholesterol plaque starts to get sort of this oozy, custardy, cottage cheese type consistency, and it actually can start to stretch the lining. It actually burgeons underneath the lining, but it starts to stretch this cap, and suddenly your husband comes home and tells you that he wants a divorce, or your daughter comes home and tells you that her husband wants a divorce, and you're sitting there receiving that information, or you've just been laid off from your job. The stress chemicals eat away at that cap, and bloop, it's like a pimple, it's like a boil, and suddenly you've had a stroke, suddenly you've had a heart attack, because the blood supply downstream here is completely cut off by this exploding, literally exploding inside your blood vessel. Now, if that happens in the heart, it's called a myocardial infarction. If it happens in the head, like it did with Roosevelt, it's called a stroke. If it happens downstream, we've all been hearing commercials about PAD or peripheral arterial disease. The most significant manifestation is that of gangrenous toes, but it can cause pain in your legs, etc. If it happens in the large aorta that leaves your body and courses to the rest of leaves your heart rather and courses to the rest of the body, it's called an aneurysm. And again, it's the same process. These are data that were gathered from young men and women who died in Vietnam and Korea in 1963. By the age of 20, they already had the beginnings of this process. And if you continue to feed it with poor choices and poor adaptation to life, you will, in fact, develop heart disease. So what are some of these risk factors I'm talking about? Well, clearly age is one of them. As we age, gracefully or not, our skin changes, our eyes change, our hairs change, and so does the lining of our blood vessels. It becomes more brittle, they become more tight, and we're more apt to develop high blood pressure. Cigarette smoking. Why do people smoke? Well, some get addicted when they are teenagers. Certainly, we all know that. But the other reason people smoke is because they're anxious, because they're tense, because it relieves some symptom that they have. Obesity is an epidemic. Diabetes, dyslipidemia is a fancy word for abnormal cholesterol, high lousy cholesterol, low healthy cholesterol, largely due for poor eating habits and decreased exercise. Hypertension, high blood pressure. These are something you probably can avoid once you have them. Family history. If you have a first-degree relative who's had a heart attack prior to the age of 55 or a stroke prior to the age of 55, you have a genetic predisposition to develop this disease more easily. Sex. Doesn't mean if you're having any, although it is a great stress reliever. It means that men are more prone to develop this disease earlier in life than women.